If we look at the side effects that we impose on patients through surgery, radiation, medical treatments, they are the acute ones and they're the long-term ones. The acute ones, very often patients expect that they should happen, but this is not true. We have evidence that appropriate preparation to surgery will decrease the side effects from surgery and anesthesia. Appropriate care in the radiation therapy environment will reduce the impact of the radiation therapy on the patient. And the use of appropriate supportive care will decrease many of the side effects of treatments, not only of chemotherapy, but also of immunotherapy and other treatments like hormonal therapy in the acute phase and in the long term. To which extent should we tell the patients about this list of side effects that can happen? It depends. It depends on the patient, how much the patient wants to know. The patient has the right to know everything, but we have to explain one thing to the patient. I always say this. When you get your package with the drug and you open the leaflet, you will see a long list of problems. This long list of problems relates to the fact that regulatory authorities want you to say that anything that happens during the study might, maybe, possibly be related to the drug. So you have a long list of things which have nothing to do with the drug. And some of them might be related to the drug. So you have already to restrict to what is most likely to be related to the drug. And then also to say to the patient, if you feel something that is not acceptable to you, don't accept it. Tell your treating team, your nurse, tell that to your oncologist, tell that to your GP. It's not acceptable today to just say, well, I have this and there's nothing we can do, because sometimes, regrettably, we cannot do something. But in many cases, we can intervene and we can decrease the symptoms of the patient if we cannot avoid them by appropriate supportive care at the beginning. So what I've been saying for years to my colleagues is that the day we have someone like Steven Spielberg doing a movie about a cancer patient and not showing the cancer patient in the bed with an IV line, looking awful, vomiting, and saying this is a cancer treatment, but actually showing a cancer patient enjoying life, doing well, thanks to adequate supportive care. And because the patient said, doctor, I'm not okay, what can you do? And the doctor saying, of course I can do something. Thank you for having told me about this. Your diarrhea is not inevitable. We can do something about it. But the patient has to ask the question. If the patient comes in and says, no, doctor, everything is okay, and then tells the nurse, actually, I have this, actually, I have that, actually, I have that, that's a waste of time.